Scissor skills are the ability to use scissors safely and effectively to cut paper and other materials. For occupational therapy students preparing for exams, understanding this complex fine motor skill is absolutely essential. It is a frequent topic in pediatric assessments and a common goal in therapy plans. This skill is more than just cutting, it represents a significant achievement in a child development. Motor control, sensory processing, cognitive planning into one coordinated action. These skills are linked to school readiness and academic success. Understanding the typical developmental sequence of scissor skills is critical for assessment and goal setting. Children do not learn to cut complex shapes overnight. It is a gradual process that builds over several years. Knowing these milestones allows you to determine if a child's skills are age-appropriate or if there is a potential delay. The journey often begins around age 2. At this stage, a child might show interest in scissors and make small, single snips on paper. Between ages 2.5 and 3, the child starts to cut across a 6-inch piece of paper into 2 halves. By age 3.5 to 4, children can cut along a straight line about 6 inches long. By 5, they can manage complex shapes like triangles and simple figures like houses. At age 6, a child can usually cut out complex, detailed shapes with multiple curves and angles. This progression, as noted by K. Smith and O'Brien 2015, demonstrates the maturation of intricate motor planning and bilateral coordination, which are essential for advanced, functional cutting tasks. For your exams, you should be able to recall the general age ranges associated with each new cutting ability. This guide will help you master scissor skills for your upcoming exams. Successful scissor use is not a single skill but a combination of motor and sensory components working together. One critical component is bilateral hand use. When cutting, dominant hand operates the scissors, non-dominant helper hand holds and turns the paper. Hand dominance means consistent use of one hand for skilled, precise tasks. Ideal wrist position is slight extension, bent back just a little for efficient muscle function. Scissor grasp should be thumb up, thumb in the top loop, middle and index fingers in the bottom loop. Graded motor control means using the right amount of force and speed. Open, just wide enough, close smoothly. Visual motor integration is processing visual information to guide hand movements, seeing the line and directing scissors to follow it. When evaluating a child's scissor skills, start by setting up a safe environment with child-safe scissors and pre-drawn lines. Follow a developmental progression. Begin with single snips, then straight lines, curves, circles, and squares. Single snips check the basic opening and closing action. Straight line cutting observes forward movement and staying near the line. Use a simple checklist to score performance. Hold scissors correctly, uses consistent dominant hand, stabilizes paper with helper hand. Emphasize square cutting, stop at corners and reposition paper with the helper hand. Note qualitative factors. Does the child appear frustrated, fatigued, rushing, or overly cautious? Document both quantitative checklist data and qualitative notes to support reports and intervention planning. When a child's scissor skills are delayed, it often indicates an underlying issue. One frequent cause is poor hand strength. Poor bilateral integration causes difficulty using both hands together. They may not use their helper hand to stabilize and turn paper. Visual motor deficits show as adequate hand strength, but struggle to guide scissors along a line, a hand-eye coordination problem. Visual perception deficits affect distinguishing cutting lines from backgrounds or perceiving spatial orientation of shapes. Recognizing red flags is crucial. If a child over 5 cannot cut simple shapes like circles or squares, it is a significant red flag. Warning signs include very immature scissor grasp, inability to stabilize paper, or extreme frustration and avoidance. A child who continues switching hands for scissors after age 5 may have issues establishing hand dominance. These signs suggest comprehensive occupational therapy evaluation is needed to identify root causes and provide targeted support. Evidence-based interventions target underlying components. For poor hand strength, use therapeutic putty, squishy balls, and clothespins. Improve bilateral integration with two-handed activities, string beads, tear paper for collages, roll dough with rolling pins. When practicing scissors, start with easy materials. Snip Play-Doh, straws, thick cardstock for extrasensory feedback. Always ensure appropriate grasp and good wrist position. Correct habits early, it's easier than changing them later. According to K. Smith and O'Brien 2015, targeting prerequisite motor skills is more effective than simply repeating the frustrating task. Build capacity and confidence before tackling the complex skill. This preparatory work makes using scissors much easier. The core principle is working on underlying components that are weak, not just practicing cutting repeatedly. To keep children motivated, make practicing scissor skills fun and engaging, adapted to their current skill level and age. For toddlers ages 2 to 3, focus on pre-scissor skills. Give them tongs or tweezers to pick up cotton balls and pom-poms. Once ready for scissors, start with snipping. Give them narrow paper strips to make fringe. Tell them they are giving the paper a haircut. Have them snip drinking straws into small pieces to make beads and string them into necklaces. Short and satisfying activities. For older preschoolers, ages 4 to 5, introduce cutting along lines. Draw roads for toy cars or paths for animals to follow. Cut large simple shapes like circles for suns or squares to build houses as part of larger craft projects. Introduce different textures like wrapping paper, aluminum foil, or fabric scraps for sensory engagement. At this stage, goal is not accuracy, but becoming comfortable with the tool and cutting action itself. For school-aged children 6 and up, create complex projects. Cut magazine pictures for themed collages like My Favorite Foods. Making paper snowflakes is excellent for practicing cutting on folded paper and navigating intricate angles. Have them cut coupons from newspapers, functional tasks that demonstrate real-world use of scissor skills. The key is making activities meaningful so children are motivated to complete them. Supporting development requires collaborative effort. Ensure children use right equipment, child-safe scissors, correct size, both right and left-handed options. Teachers can make simple adaptations. Thicker, darker cutting lines, brightly colored paper, shorter tasks to avoid fatigue. Positioning is key. Child sits at correct table height with feet flat on floor for stable posture and fine motor control. For home programs, suggest cutting boxes with different materials, old greeting cards, junk mail, yarn for frequent low-pressure practice. Use adapted scissors when needed, loop scissors for weak hands, spring-loaded scissors for opening difficulties. Advise parents to focus on effort and participation rather than perfection, offering plenty of praise to build confidence. These tools act as bridges, allowing children to experience success while developing underlying motor skills. Collaborative support from therapists, parents, and teachers makes significant difference in skill development. As you prepare for your exam, use this concise checklist to review key concepts and ensure you have covered all essential information. Definition: can you define scissor skills and explain their relevance to school participation? Milestones: expected cutting skills at ages 2, 3, 4, and 5 years old. Components: key motor and sensory components, bilateral integration, hand dominance, grasp, graded control, visual motor integration. Assessment: steps of clinical observation and simple checklist items for systematic evaluation. Causes: common causes for delays such as weak hand strength, poor bilateral integration, visual motor deficits. Red flags: signs that warrant referral, inability to cut simple shapes after age 5, immature grasp, extreme avoidance. Intervention: preparatory activities for strength and coordination, followed by direct cutting practice with proper technique. Strategies: practical tips for parents and teachers, environmental adaptations, and tool modifications. Evidence: key sources that inform practice. Case Smith and O'Brien 2015, Bundy and Lane 2020. Our goal is to give you clear, thorough understanding. By the end, you will have knowledge and confidence for exam questions. To finalize preparation, try these sample exam-style questions, focusing on clarity and accuracy in your responses. 1. A 4-year-old struggles to turn paper and chop circles into pieces. What underlying component is most likely contributing to his difficulty? 2. Develop intervention plan for 5-year-old with poor hand strength. Describe 2 preparatory activities and provide rationale. 3. Parent asks about introducing scissors at home. What 3 key recommendations ensure safe, positive, developmentally appropriate experience? Strong performance on these questions demonstrates your grasp of pediatric fine motor development, assessment, and intervention. Remember to think like a therapist. Connect child performance to underlying components, link intervention plans to assessment findings. You will be ready to help children develop this crucial life skill and support their participation in school activities. Good luck with your studies and upcoming examinations. You now have comprehensive understanding of scissor skills development.